quotes I love is this one by Babe Ruth, who's a famous baseball player in America. And basically, the way a team plays as a whole determines its success. You can have the greatest bunch of individual stars, but if they don't work well together, the club won't be worth a dime. And that's very much true in an operating setting. You can have the most talented surgeon in the world, but if the rest of the team is not on the same page, it doesn't work. So it's important to keep that in mind as you go through this process.
The first thing is to establish a team, and it's a team of anesthesiologists, surgeons, nurses, and assistants. And you need a dedicated team, one that will keep showing up. It has to be a consistent team. You can't have, to be effective, I think, people coming in and out and learning and forgetting and trying to relearn the steps at all the levels, the nursing and the assistant level in particular.
Keeping in mind the attitude, aptitude, and the surgical training and the surgical acumen of all our surgeons in our own country, ideally, we should aim at the team training. Every hospital should have a pre-planned strategy, select the team before they send to the training, and see to that the whole team is trained simultaneously, accomplished in both the electronic and the mechanical devices of the system.
To me, it's like cardiac surgery or neurosurgery. You can't have people rotating, on the robot on Monday and urology on Tuesday and orthopedic surgery on Wednesday. It's got to be a team that's consistent, because there are going to be issues with the robot. If there's a malfunction or just working it, just being around the equipment, it's easy to contaminate it before you even dock the robot. So you just need to have people who are familiar with it and they really, rather than having them learn on the job.
Very important, one of the most important things perhaps is that you have your logistics are there. You need a team that is dedicated to robotics, that know robotics very well, and that can help you. We know that one of the major factors deciding how long your warm ischemia time will be is probably the bedside surgeon. He is the one who has to show you with his suction device where the defect is and so on. He is the one putting the clips. And so this is very, very important.
How to reduce cost, reducing OR time is the key one. So, doing things that are streamlined, having a team that works, having a team that goes and trains well is important, because then you can work well as a team.
There is a trained personnel who are robotic technicians. There are anesthetists who are used to working with you. So it is better to have a robotic theatre where, along with other specialties, you also try to fit in.
And I think that the key things to look at with robotics is find yourself a team, focus on the basic operations, pyeloplasty, potentially reimplants, use nephrectomy as a learning device. No, you can do it laparoscopically, of course, but it's a great way to get used to the robot and then move yourself up to the progressively more complex procedures. But if you've tried laparoscopy for reconstructive work, you will love the robot.
Teamwork is ultimately what this is all about. When I trained in November of 2001, that's when I started robotic surgery. I teamed up with a GYN oncologist who I convinced to look at this technology, and I took 3 of my best nursing staff, and all 5 of us did our training together. And by doing so, what it did is it allowed us to be able to, as a team, understand what it means to use the robot, both from a nursing standpoint, a circulator standpoint, bedside assistant, and console surgeon perspective.
I really believe that until we all, the believers from all over the world, team up, lobby, and come up with a plan in heart surgery, just like Dr. Trehan suggested to do, and with the catalyst, with the foundation as a catalyst, that will go nowhere.